getting to the next to last presenter here. It's Mira who will give us a talk on blood exposure, ventricular zone response to blood exposure at various time points. Do we have Mira on the floor?
Hello, my name is Mira and I work under Dr. Carolyn Harris at Wayne State University in the Department of Chemical Engineering. In this presentation, I'll be discussing the response of astrocytes when exposed to blood. As most of you are aware, the treatment for hydrocephalus has one of the highest failure rates out of all neurological devices. Studies have shown that 40 to 50% of shunts fail within the first 2 years post-surgery, with obstruction accounting for 70% of these failures. Patients that experience hemorrhages within the brain are at one of the highest groups for risk of shunt failure by obstruction of the proximal catheter. The introduction of blood into the ventricular space can cause shunt obstruction and inevitably the need for revision surgery. Exposure of the ventricular zone to blood causes a disruption in the ependymal layer, allowing for an increased dilation and permeability of the ventricle. This increased permeability is associated with dislocation of cell junctions and impairment of ependymal cell differentiation. Both factors lead to an overall loss of cells, creating holes in the ventricular wall. Glial activation occurs from the exposure of astrocytes and microglia to blood, which can cause an increase in shunt obstruction. Post-hemorrhagic hydrocephalus occurs when the ventricles become dilated following a hemorrhage within the brain. Adult patients that develop a hemorrhage will progress into post-hemorrhagic hydrocephalus in 42 to 52% of cases. And out of these patients, 50% will develop hydrocephalus. These hemorrhages can take 4 to 8 weeks to heal, allowing the ventricular zone to be continuously exposed to blood. Along with hemorrhages, shunt insertion causes breaking of the blood-brain barrier, which exposes the ventricular zone to blood. At 1 day post-surgery, a maximum concentration of blood within the cerebrospinal is reached, but the ventricle will continue to be exposed to blood for up to 2 to 3 weeks. The trauma associated with shunt insertion causes multiple negative effects, such as immunoinflammatory responses along with disruption of the ventricular zone. In our experiment, our goal is to understand the cellular response when the ventricular zone is exposed to blood and its effect on shunt obstruction. We began by focusing on blood entering the ventricular space when the blood-brain barrier is broken during shunt insertion by utilizing known physiological time points. A novel chamber system was created using a 3D resin printer. Thermal-resistant resin was used to develop a well that allowed for the seeding of cells onto a glass cover slip with exposure to blood and a shunt. Glass cover slips were attached to the base of each well using silicone glue. Samples were prepared to replicate industrial-made catheters by punching holes into a silicone shunt using 20-gauge needles spaced 1 millimeter apart. In this experiment, we utilized primary mouse astrocytes and blood extracted from mice using a full-body massage technique. After allowing the cells to become completely confluent, we added the shunt into the culture by inserting it into the 2 holes along either side of the well. This can be seen in the photo marked A. At the same time, blood was added into the media used for the cell culture. A representative image of the catheter sitting on top of the cells is shown in the photo marked B. In this experiment, we exposed our samples to blood and a catheter on the same day. Blood was added into the media for 2 weeks to represent the amount of time it takes for the blood-brain barrier to heal. After the 2-week period, the samples were fixed and the cells attached to the catheter were analyzed using immunofluorescent imaging and staining. They were then counted and compared to control samples, which were not exposed to blood. The blood samples showed a significant increase in both cell count and GFAP expression between the 2 groups. The activation of the astrocytes in response to the blood can account for this increase in cells attached to the surface. GFAP expression when exposed to blood is more than double the average cell count. This increase in expression can be attributed to a change in morphology to a more spread out shape to cover more space over the surface when exposed to blood. The development of a novel chamber system was required to replicate the insertion of a catheter directly on top of the cell layers and expose them to blood. With this system, we can also take images of the samples without removing the catheter from the culture. Analysis of the samples showed that samples exposed to blood caused a significant increase in cell count and GFAP expression. The activation of the cells caused an increase in cell count, and the high expression of GFAP indicates a more spread out morphology. In future work, we plan to investigate other time points associated with blood entering the ventricular space. This would include disruption of the ventricular zone when exposed to blood for the length of an intraventricular hemorrhage. Studies have shown disruption over a short period of time, but our plan is to expose the cells for 4 weeks to represent the time a hemorrhage lasts. From the information learned, we plan to test how this disruption affects the obstruction of the catheter. We also will be able to understand why it causes an increased risk for patients who develop post-hemorrhagic hydrocephalus. Currently, we're running experiments using neurostem cells extracted from mice and differentiated into ependymal cells for exposure to blood for 4 weeks. We're also running the same test, but with cultures of neurostem cells purchased and differentiated into astrocytes. With that, we aim to obtain a further understanding in the cellular response of ependymal cells and astrocytes when exposed to blood. And with that, I'd like to thank you for listening to my presentation. Do you have any questions?
Thank you very much. There are questions indeed. It was very interesting. Thank you for a very nice presentation. I'll start reading here. There are 2 questions about the model and the chambers here. What material did you use to print the chamber? And does the roughness of the surface have an influence on the study?
So we used a thermal resin that we used for 3D printing, and we placed a glass cover slip down to take care of any roughness of the surface. So it should be a smooth surface that the cells are seated on.
And what about the dimensions of the chamber? Could you please specify that?
The chamber dimensions were, I want to say, about 15 millimeters in diameter to allow for all 8 holes of the catheter to be present and able to be exposed to the cells.
I have a question too. It's interesting to speculate on the mechanism in post-hemorrhagic hydrocephalus. And could you speculate, is there a possibility of a treatment to prevent the development of hydrocephalus attacking this part of the pathophysiology?
Yeah, I am not quite sure of how you would do that yet. I think that understanding a little bit better as to what exactly happens would be needed, but so at the time I don't have an answer to that question.
But do you think you can prevent this, what you see when you expose the cells here? Is there a possibility of a drug or something that could be used?
I would be interested to know though if, because the blood-brain barrier is made out of similar idea of cell junctions holding your ependymal cells together. So maybe if there was a way to use those rather than the ones that are dislocated in the ventricular zone, that would be an interesting way to maybe treat this and prevent it from happening.
Okay, I think we need to stop there. So thank you very much for this talk.
Thank you very much. Thank you very much. Now we have the presentation from Dr. Zaranek, who's going to talk about treatment of hydrocephalus with GAT27 to inhibit interleukin 1B astrocyte activation. Please, Dr. Zaranek, come to the stage.
My name is Mira, and I work in Dr. Carolyn Harris's lab at Wayne State University in the Department of Chemical Engineering. In this presentation, I'll be discussing our experiment utilizing the immunomodulatory properties of GET27 to inhibit the cytokine response that accompanies shunt insertion. As you all know, the treatment of hydrocephalus has failure rates of 40% within the first year post-surgery. The leading cause of failure is obstruction of the proximal catheter, preventing the cerebrospinal fluid from exiting the brain. The immunoinflammatory response associated with shunts has been shown to cause an increase in microglia and astrocyte proliferation, which make up the majority of the obstructions. Observation into this response showed increased levels of pro-inflammatory cytokines such as IL-6, IL-8, and IL-1 beta, along with anti-inflammatory cytokines like IL-10 following shunt failure. GET27 is an immunomodulatory agent with properties that have been shown to regulate the cytokines TNF-alpha, IL-1 beta, IL-10, and IFN gamma. It works by blocking toll-like receptor 4 on microglia along with astrocytes. This inhibition subsequently decreases the secretion of these inflammatory cytokines. In this experiment, we investigated the response of astrocytes seated on a silicone shunt when exposed to GET27 to understand its effectiveness at decreasing cell attachment. 2 trials were run to determine the concentration and mode of delivery for use in an effective treatment using GET27. Briefly, in the first experiment, we used a plasma etcher to attach OH groups onto the surface of the PDMS, allowing for the attachment of the GET27 coating. Using nanodrop analysis, we determined a stable coating with a concentration of 1 milligram per milliliter. In the following experiment, we used this concentration to test the effectiveness of GET27 on cellular attachment. Here we had samples seeded with human astrocyte cells and exposed to GET27, both attached to the PDMS surface and in suspension within the media. Due to the solubility of GET27 in DMSO alone, controls without anything added to the media along with controls with DMSO vehicle were conducted. Following a 2-week incubation period, immunofluorescent analysis was conducted and it was determined that the samples where the GET27 was in suspension within the media showed a significant decrease in cellular attachment. We then utilized this knowledge to develop this experiment to test the inhibition of IL-1 beta and IL-10 in human astrocyte cultures. Using the exposure of our cultures to cytokines to represent the insertion of a shunt, we analyzed the effect of GET27 at 3 time points. Samples were exposed to the treated solution before, at the same time, and after shunt insertion. Time points were chosen to observe GET27 as a pre, post, or simultaneous treatment and determine when would be most effective. The treatment of the cultures before shunt insertion are represented by this top timeline, which indicates an exposure to GET27 during the first week with re-inoculations on days 1 and 5. On day 7, the media changed to a solution without GET27, but the addition of either IL-1 beta or IL-10. The samples were then re-inoculated on days 9 and 12, with the experiment ending on day 14. In a similar fashion, exposure of the samples to GET27 at the same time as shunt insertion are displayed on the middle timeline. Here, the first week, the cells were exposed to GET27 and cytokines together. In the second week, both were removed. GET27 exposure after shunt insertion was represented by media containing the cytokines during week 1, and then only GET27 the second week as seen in the bottom timeline. Analysis of the cell counts was done using a linear regression to test if time was the mitigating factor as to why the cell counts vary. Once determined, we analyzed the samples by group using the Kruskal-Wallis test followed by the Dunn's test for multiple components. Samples exposed to GET27 before either IL-1 beta or IL-10 showed no significant difference in the slope of the linear regression. This indicates no time dependence for the cell counts. The before samples exposed to IL-1 beta showed a significant decrease in cells between the control samples and the GET27 samples. For the IL-10 group, the decrease in cells compared to the controls was only seen in the group exposed to the vehicle DMSO. Comparisons between the GET27 group and DMSO vehicle group showed no significant difference in cell counts. When the cells were exposed to cytokines and Git27 at the same time, we again saw no significant difference in the time variable. When the cells were inoculated with IL-1 beta, there was a significant decrease in cell counts compared to both the control and Git27 group. This would indicate that the DMSO group caused the cell count to decrease. For samples exposed to IL-10, the cell count decreased significantly compared to the controls for both Git27 and DMSO. When comparing the difference between Git27 and the vehicle DMSO, the Git27 group showed a decrease in cells even though that decrease was insignificant. Analysis using the linear regression showed that the samples exposed to Git27 after cytokines showed a time dependence. The group exposed to Git27 after IL-1 beta and the DMSO inoculated samples following exposure to IL-10 showed a significant difference in the time variable. Peeling of the cell layer occurred in the samples exposed to DMSO after IL-10, but peeling began before inoculation with DMSO, indicating it potentially is not the reason for the decrease in cells. When we compared the Git27 group and the DMSO vehicle group, we saw no significant decrease in cells when exposed to IL-10, but we saw a significant decrease when exposed to IL-1 beta. Our data suggests that there is no time dependence for most of the samples, and the DMSO vehicle group showed to have the greatest effect on the cell count across all samples. Git27 only showed to be effective at decreasing the cell count more than the vehicle group when exposed before IL-1 beta and at the same time as IL-10. In the future, we plan to test the immunomodulatory properties of IFN gamma and TNF alpha. We also will look at the response of macrophages and astrocytes in a single culture when exposed to Git27. Thank you so much for listening to my presentation. Are there any questions?
Thank you very much, Dr. Zaranek. Nice presentation. Interesting track to explore and to use these drugs to prevent shunt obstruction. Nana, do you have any comments with respect to the neuroscience, I would say?
So would you imagine that one can infuse these kind of anti-inflammatory markers into patients with the shunts?
Yeah, so we've discussed either having it as a agent that's mixed in with the silicone catheter, along with potentially being like a drug that's administered in another way. But I'm not an expert in that part yet.
Very good, thank you.
Mm-hmm.
Okay, I think we're perfectly on time. Thank you very much for sharing. Thank you, Nana. Thank you for all presenters. And we have to carry on and enjoy this virtual session of Hydrocephalus 2021.
Good, thanks from me as well.
Goodbye. Thank you.
Bye.